All right, guys. Next up, we've got Burton Tabaac. He is a Johns Hopkins educated neurologist and advocate for research on psychedelics as medicine and therapy. Burton, come on up here, buddy.
Do you wonder what treatments physicians use and prescribe today that will one day be perceived as outdated with the lens and perspective of the future? Who here has heard of Ignaz Semmelweis? Semmelweis was a German-Hungarian physician and scientist in the 1840s who maintained some pretty controversial theories and beliefs for his era. His wild idea that microscopic organisms unseen by the naked eye could be the source of spreading disease. He was committed to an insane asylum by his colleagues for his radical ideas, where he was beaten, and ultimately died before Louis Pasteur confirmed germ theory shortly thereafter. Now, we are all well aware how hand washing and sterilization techniques can limit the spread of infection. It begs the question, what medical discoveries exist today that are being overlooked and dismissed? What treatments are currently accepted as appropriate that will one day be rendered ineffective, or worse, harmful? With current and modern perspective, many medical treatments of the past seem primitive and in some cases, even barbaric. From the Neolithic era, trepanation was an act of surgically drilling a hole in the skull, exposing the brain to air to allow evil spirits to escape. 5 centuries ago, barbers were regularly serving as surgeons performing bloodletting, for which the well-recognized red and white barber pole seen today derives its symbolism, representing blood and bandages. As recent as the 1940s, lobotomies were considered cutting-edge treatment for psychiatric illnesses, for which the founding physician earned a Nobel Prize. This procedure involved inserting an ice pick into the eye socket with the aid of a hammer to separate connections in the brain. Early in my career as a neurologist, I was struck by how common it is for patients to present with functional symptoms of disease without any clear or detectable diagnosis to suggest an underlying cause. I will often consult with patients complaining of numbness, weakness, vision changes, difficulty walking, and complex pain syndromes, yet the batteries of testing, comprehensive neuroimaging, and even spinal taps all result as normal. It is often that these patients' symptoms improve with talk therapy and antidepressant medication rather than antibiotics or subjecting them to surgery. There is a phenomenon well published in the medical literature called conversion, in which if a patient suffers and then suppresses emotional, sexual, or otherwise mental trauma, that real physical symptoms can manifest out of the control of the affected individual. Thoughts are powerful. They can be the seed and root of many of our problems, and ironically, may have the potential to serve as the cure. Is today's use of electroconvulsive therapy, essentially electrocution, really the best option we have at our disposal for difficult to treat depression? Is there any other instance in medicine outside of the psychiatry realm where we invite the patient to commit to months and years of a particular treatment with only some having complete and maximal healing? That standard is not acceptable when we think about treating and addressing a physical wound or injury or trauma, and yet we expect psychiatric patients to commit to years of cognitive behavioral therapy in the hopes that improvement is obtained. Talk therapy has been proven to break bad thought patterns that lead to problems and create new ways of thinking to promote healing and solve problems. Yet, progress is slow. Imagine if we could harness the power of cognitive behavioral therapy, but accelerate the process to expedite results. As a doctor, I find it puzzling that modern medicine separates neurology and psychiatry into separate disciplines, as if the brain is not one organ. As much as we have learned about the body and other organ systems, the brain serves as the final frontier. What will it take for us as a society to consider mental health as part of whole health? Please raise your hand if you personally or know someone close to you who has experienced anxiety or depression in your life. Depression, anxiety, PTSD, and addiction are ever-growing maladies in a world becoming more complex. There is a treatment avenue currently gaining a lot of attention, with tons of novel, dedicated research starting to enter the mainstream. This medicine is regarded by controversial by some and deemed pioneering by others. Regardless of where you may stand with initial impressions, there is mounting evidence to support this modality and group of drugs as having meaningful and lasting benefits for our mental health. Let's talk about psychedelics. Before sharing the latest inspiring psychedelic research and professing the accomplishments of psychedelic studies happening in America, it is imperative to acknowledge that indigenous peoples across the world and recognize the rich and diverse history of using psychedelic substances for spiritual, medicinal, and cultural purposes across time. These practices often date back centuries and likely even millennia, and are deeply rooted in traditional knowledge. Now, the earliest evidence of psychedelic use can be found in a cave in the Sahara Desert of Algeria. In this cave is a mural depicting what is referred to as the Mushroom Man, or Mushroom Shaman, a beheaded figure with mushrooms sprouting out of the body. This mural is 7,000 to 9,000 years old. There is also evidence of the use of peyote, cactus containing the psychedelic mescaline, in the Rio Grande in Texas. The researchers who discovered the specimen said, quote, "The identification of mescaline strengthens the evidence that native North Americans recognized the psychotropic properties of peyote as long as 5,700 years ago." Mushroom stones, indicating the use of psilocybin mushrooms, have been found in both Mexico and Guatemala, dating to 1000 to 1500 BC. In a 2019 study published in the Proceedings of the National Academy of Sciences, it is described the discovery of a 1,000-year-old shaman's pouch containing multiple psychedelics, including bufotenin and DMT. The pouch originates from southwestern Bolivia and also includes snuffing tablets and a snuffing tube, most likely used to snort the prepared drug. Interestingly, the pouch contained harmine, which can be combined with dimethyltryptamine, or DMT, to achieve psychedelic effects. In Africa, the San Bushmen of the Kalahari Desert have used the psychedelic plant known as African dream root to induce vivid, spiritually significant dreams. Indigenous tribes in Oceania, located in the South Pacific, utilized kava, a psychoactive plant, in their social and religious ceremonies. These examples underscore the anthropological significance of psychedelic use among indigenous peoples, as these substances were central to their worldviews, rituals, and healing practices. It was some time before Westerners discovered the use of psychedelics. It was during World War II in Basel, Switzerland, when Albert Hofmann, the chemist who synthesized LSD in a lab, imbibed a dose to experience what we consider the first proverbial acid trip. LSD is chemically very similar to the serotonin molecule, the feel-good hormone. Scientists would discover similar molecules in the coming years found in nature, including documented objective evidence of mescaline within the peyote cactus and measurable DMT within tropical plants used in the psychoactive drink ayahuasca. It was 10 years after Hoffman's discovery that R. Gordon Wasson identified strains of psilocybin in the mountains of Mexico, recognized as the active component in magic mushrooms. These chemicals, when ingested, can have effects on the brain for anywhere between 3 to 12 hours, depending on the drug and dose. It was in the 1960s that psychology researchers at Harvard, Timothy Leary and Richard Alpert, established the foundation for psychedelics as a potential treatment for mental health disease states. With a backdrop of the Vietnam War and widespread anti-war protests, Richard Nixon deemed psychedelics to be part of a counterculture movement that was a threat to his administration. This sparked media demonization, the creation of the DEA in the 1970s, along with the Controlled Substances Act. This forced all clinical research studying psychedelics to shut down, rendering psilocybin, mescaline, DMT, and LSD as illegal Schedule I drugs. The academic study of psychedelics remained absent for decades until 2006, when Roland Griffiths and his colleagues at the Johns Hopkins University penned the seminal paper titled "Psilocybin Can Occasion Mystical Type Experiences Having Substantial and Sustained Personal Meaning and Spiritual Significance." This is quite a provocative title for medical literature standards and re-sparked an entire field of research dedicated to investigating a group of restricted therapeutics in the psychedelics class. From this point forward, what was once considered taboo may now serve as one of the most promising and impactful methods of treatment for mental health. Novel safety research has demonstrated that psychedelics, contrary to 1960s reports, do not carry toxicity nor lead to dependence. Griffiths and his team recruited a group of healthy volunteers to ingest a single dose of psilocybin. From this study, most people enrolled rated their experience 1 year later as being among the most personally meaningful or spiritually significant experience of their entire lifetime. People were able to change their perceptions and create powerful, long-lasting new ways of thinking. An interesting and important discovery was regarding intention. In the psychedelic experience, the journey is heavily influenced by set and setting. That is, one's mindset and the physical setting that they are in. For this reason, it is frequent that there is a guide or shaman to assist with the curation of the psychedelic experience, ground control, so to speak. Guides will often provide music and encourage the use of blindfolds to minimize external stimuli, which allows the patient to turn their focus inward. Since the Hopkins study, researchers at some of the most preeminent academic institutions in the world are now studying psychedelics as potential treatment for mental health disease. Imperial College London, NYU, Harvard Mass General, UCSF, UC Berkeley, and Johns Hopkins, amongst other prestigious centers, are assessing how MDMA, the active component in ecstasy, as well as psilocybin, LSD, DMT, and ibogaine, or iboga, can serve as potential treatments for anxiety, depression, PTSD, and addiction. Quite dissimilar with the way in which these drugs were used in the 60s and 70s, there is now a more targeted approach for the way in which these medicines can be offered in a controlled clinical setting. In one study, psilocybin helped 2/3 of cigarette smokers enrolled quit smoking cigarettes for at least a year. That is the most successful smoking cessation treatment ever studied. Thoughts are powerful. In 2009, Dr. Robert Carhart Harris carried out the first clinical study of psilocybin in the United Kingdom. This was also the first clinical study of a psychedelic in the UK in 40 years. In 2011, Charles Grob published research showing that psilocybin was highly effective at reducing anxiety in patients with advanced cancer. In 2014, a network in the brain was identified as the default mode network. These regions make up what psychologists refer to as the ego, or sense of self. These interconnected areas are very active in states of depression and anxiety, yet temporarily are inhibited when under the influence of psychedelics. A dedicated meditation practice also taps into and can inhibit the default mode network, in which mindfulness allows for self-awareness and can promote personal growth. I invite you to think of your mind as a snow-covered hill in which your thoughts are sleds. Over time, the grooves are dug deeper and deeper, making it difficult to escape the path that is created. These paths, representative of our internal dialogue, then become ingrained. Psychedelics allow for a fresh mound of snow, so to speak, to be laid, which allows for new paths, thoughts, connections, and interpretations to be made. This may explain how psychedelics are effective at treating the ruminating thoughts consistent with addiction, anxiety, and in depression. Now, imagine if we could harness the power of our thoughts to promote healing, rather than letting them instill harm. Integration is a crucial component to maximizing the potential benefit garnered by the psychedelic experience. Once consciousness returns to its baseline state, it is necessary to work to interpret and understand what was encountered on the journey. The real homework starts then to try to apply what was learned and discovered to day-to-day life. The preliminary results from these drugs are fascinating in that the effects from one single dose can be profound and long-lasting. Patients are given the opportunity to have an experience in which the mind is open to possibility, to work through a prior trauma, and see something with a new light. This is very different from the current standard of care for mental health, which implements daily medication regimens and necessitates years of intense cognitive behavioral therapy. Australia has become the first country to recognize both MDMA and psilocybin as medicines, with healthcare providers able to prescribe these in the right clinical setting and for the right patients. A true breakthrough treatment as recent as last summer. States in the US, like Colorado and Oregon, have passed bills to legalize therapeutic access to psychedelics. There are currently 24 cities and 2 counties in the United States that have decriminalized entheogenic plants and fungi like psilocybin-containing mushrooms, mescaline-containing cacti, with the exception of peyote, in an effort to support ecological conservation and indigenous access, DMT, the active component in ayahuasca, and ibogaine, an alkaloid from the iboga plant. 10 states have passed study bills for research. New Jersey passed a statewide decolonization for psilocybin, and as of late July 2024, 8 states have active legalization for statewide initiatives. Beyond the benefits of psychedelics for mental health, there are other medical avenues of research being conducted with enthusiasm. Clinical trials are currently being pursued to investigate psilocybin, MDMA, ibogaine, and LSD for diagnoses such as chronic pain, fibromyalgia, obsessive-compulsive disorder or OCD, eating disorders, and even neurological pathologies like traumatic brain injury, Parkinson's disease, Alzheimer's dementia, and stroke. Check this out. Dr. Gould Dolan of Johns Hopkins published a paper in Nature showing that psychedelics can reopen critical periods. What's a critical period, you may ask? These are times of learning, usually in childhood, where certain pathways are established in the brain. There's all sorts of critical periods. One for hearing, another for vision, and one that Dr. Dolan even discovered, the social reward learning critical period. This is important. For instance, if a child is born with cataracts in their eyes and you wait until they are 9 years old to surgically remove it, they will remain blind despite addressing the problem. This is because the vision critical period has closed by that time. With Dr. Dolan's novel discovery, there may be hope because we now know that all psychedelics can reopen these windows. A particularly promising area is in stroke recovery. When patients suffer a stroke, they are classically left with residual deficits like weakness or language problems, for example. The typical period for recovery after stroke is about 3 to 6 months, during which time the patients pursue physical therapy and occupational therapy regimens. You can expect that a year out from the insult to the brain, patients are going to be left with some degree of disability. Now, imagine designing a study where you recruit stroke patients a year or two out, or even longer, and then you pair psychedelics with physical therapy exercises. Could you regain more function beyond the typical recovery window? This is beyond the current approach of training compensation, but rather promoting true healing. Just imagine the possibility here. This would be a paradigm shift. Here is another fascinating and inspiring example of psychedelics in the latest breaking science world. Dr. Nolan Williams, a Stanford dual-boarded psychiatrist and neurologist, recently presented data studying ibogaine in special operations forces for healing traumatic brain injury and PTSD. He imaged the brains of Navy SEALs before and after a trip to Mexico, where this powerful psychedelic, found from the root bark of a tree that grows in Gabon, Africa, is ingested. The results are mind-blowing. Not only did all 30 veterans studied no longer meet criteria for PTSD at the 1-month follow-up, but even more fascinating is the evidence that ibogaine increased white matter in the brain. This means that ibogaine has the power to, at least in part, heal brain tissue and address the traumatic brain injury itself. Using an AI algorithm, Dr. Nolan Williams was able to demonstrate a decrease in measured brain age of the treated patients in the study. Wow. There's still much work to be done. These medicines are not without risk, are not for everyone, and certain screening measures should be put into place to identify those at risk for schizophrenia and other psychotic illnesses. There's no doubt that this class of medications can be dangerous, sending some off to the metaphorical deep end, and interactions do exist, and there is potential for harm if the patient is taking other medications that can affect the serotonin system. I would argue that there is a need for continued research and double-blinded randomized controlled clinical trials to test proper dosing and to compare to the current standard of care. Can anyone guess the single biggest inhibitor to progress in psychedelics? I'll give you a clue. It's the same reason why progress in all areas of mental health and substance use have been slower than in other areas of medicine. It's also the same reason why perhaps some of you who suffer from anxiety or depression didn't raise your hands when I asked before, and it's judgment. Progress has been forced underground. The current medical, legal, and pharmaceutical industrial complex considers psychedelics for treating mental health at a snail's pace. States consider ballot measures and introduce legislation in a patchwork and conservative fashion. Given the current scheduling of psychedelics, there are immense guardrails and hurdles that have to be overcome in order to study these medicines. The Schedule I designation is clearly not a medical one, but rather a political one. Here's a great example to underscore this point. Marijuana is considered an illegal Schedule I drug, which by definition suggests that there is no medicinal value, and yet the FDA has approved both Marinol and Epidiolex to treat medical conditions like decreased appetite in cancer patients and epilepsy patients with refractory seizures, respectively. As a medical professional, I find it interesting that when I connect and interact with colleagues, including psychiatrists, therapists, mental health coaches, and other fields of expertise who inquire about psychedelics. Unfortunately, these therapeutics are not even mentioned in a conventional Western medical education. I don't recall psychedelics being presented once in 4 years of medical school and 5 years of residency, not even one line in one slide. The odd piece to all of this is how my colleagues approach me with respect to this space, not simply with the curiosity to learn, but more so with hesitancy and fear about collaborating and wanting to do so anonymously when discussing the current state of psychedelic treatments given the DEA designation. Progress has been forced underground. As the current medical, legal, and pharmaceutical industrial complex considers psychedelics for treating mental health, there is a newfound space outpacing the legacy system for discussion, debate, and approval. Have you ever heard of Web3 or the metaverse? With blockchain technology and NFTs, people are connecting with each other behind anonymous avatars to build community through collections of art, technologically secure internet connections, and shared interests. NFTs like Psychedelics Anonymous is one such collection that attracts psychiatrists, therapists, mental health coaches, and other fields of expertise to collaborate anonymously and discuss the current state of psychedelic treatments. This is done without boundary of borders or being constrained by the threat of perception. Now, what does this say about our society that scientists, researchers, and physicians are using avatars for fear of reprisal if they are open about what they are advocating for? How would your perceptions change if you knew that your doctor suffered from depression? How would you view your physician if you knew that they had experienced psychedelics in their personal life? There is clearly still taboo due to controversy and perception in the media dating back to Nixon's war on drugs. We are still in the nascency of understanding how the brain works. I maintain hope that what is being fostered by organizations like Psychedelics Anonymous and PACT to shape perception, and through the scientific discoveries and evidence obtained through research at Johns Hopkins and the like, that we do change the way in which we think about mental health. What would the world look like if we didn't force the best minds underground with their best ideas in this country? Why do so many brilliant people only feel safe to discuss psychedelics discreetly for fear of retribution by their colleagues and by society at large? Semmelweis was brave. He shared his opinions and voiced his theories openly and advocated for what he believed in, despite it being unpopular at the time. And for this, he paid the ultimate price. Judgment is real. Our internal dialogue and preconceived notions may be tough to break and change. Yet, there is a blizzard coming, and now we have an opportunity to lay some fresh tracks, because thoughts are powerful. Be bold. Advocate for your loved ones. Advocate for yourself. Advocate for mental health. Advocate for healing. And advocate for the potential and power of psychedelics. Thank you.